Welcome to Healing Through Dentistry podcast,
where we redefine health, wellness, and the power of your smile.
We're your hosts,
Hana
and Eva, twin sisters, qualified dentists and medical doctors.
This is more than a dental podcast.
It's a journey into profound connection between oral health and whole body healing.
Through personal stories, inspiring client transformations, and expert insights,
we explore how dentistry can ignite energy, relieve chronic pain, and transform lives.
Get ready to discover the extraordinary ways your smile can heal, inside and out.
Let's begin. Welcome to a next episode. This is Eva and Hana from Duo Smile from the Czech Republic, and we're talking today about stories from our clinic. And let's see what Hana tells us today, because we are not having any pre-talk, so I'm pretty excited what I will hear.
Right. Welcome everyone, and thank you for listening. And we decided to share stories because the stories are, in my opinion, the information you might appreciate because you might see some of the symptoms, some of the stories people do have in yourself too. So I've had a very interesting one recently, a few weeks ago actually. A young mother of two came over to the practice, and one of the questions I asked, how did you find us? And she said she has found us on website on Google, but based on a referral, because she went to see a practitioner who was using a frequency device, and she told her that she's got high amount of mercury in her body, which is causing her problems. And how the story actually started, what we do ask our clients when we see them is to tell us their story, like what bothered them. So I always ask, the very first question is, where did you find us? The second question is, how can I help you? Is there anything which bothers you? And it doesn't necessarily mean that they need to jump into, my upper left tooth is, sensitive and biting. It is actually quite interesting, Eva, that people do that very rarely in our clinic, right? And so she started to explain me, based on my question, that she's got a second daughter. She's now 1.5 years. And she's had a terrible eczema. She was suffering with a terrible eczema. She didn't know what to do. She's got one child who is 6-year-old, and now she's got a daughter who is 1.5 years. And she said, I haven't had it with my first baby, and this baby, I follow the same diet, same stuff, but the little one, she's got a very severe eczema and she scratches herself and I don't know what to do. And so she started to obviously, dig deeper. She started to find information. She started to eat no gluten, no dairy. She said it didn't help. And then she found this practitioner who was having a frequency device. You might know, like in the Czech Republic, it's known under the name of BICOM, B-I-C-O-M, or different frequency devices. And this device, based on frequency, can measure you, what do you have in your body. It can be viruses, it can be toxins, it can be heavy metals. And this practitioner very strongly suggested to this lady that she is being poisoned by mercury. She's got a high amount of mercury in her body. And she actually indicated it. She was pointing towards upper teeth, upper 6 and 7. So I remember on my very first visit, my client, she was just saying, it's on the upper teeth. She said it's on the upper teeth. Yeah, anyway, fast forward. And also she was complaining about a thyroid gland issues. She said she's on a medication and she's got an autoimmune disease and she needs to take pills, which she was not happy about. Anyway, fast forward, I saw her. I did see that she's had several amalgam fillings, not only on the upper teeth, but also on the lower teeth. I can't remember the exact number, but I think it was around 3 times 4, 12 amalgam fillings. And also we saw them on the upper molars. And yeah, so what was very interesting, what she said when we removed them, when she came over in a couple of months after when we removed the fillings, or actually it wasn't after a couple of months. I think we scheduled every 2 weeks one appointment. And after the very first two, she said what was incredible is that she saw her practitioner, her GP, and she said the thyroid gland is much better. So she lowered her medication,
Nice.
which is really, really cool.
Which is based on the information that, according to Chinese medicine, upper molar, first molar, is on a meridian of stomach meridian. However, it's on a thyroid gland. So we have lots of clients with beautiful results, not only due to thyroid gland and kind of autoimmune signs of illnesses, which is like recently we had a great experience with a client who dropped her levels, her autoimmune antibodies from 1300s to 50 in 3.5 months, but also with in terms of palpitation, the heart palpitation, because thyroid gland is like the gland which is orchestrating all the hormones. So we have lots of clients who had heart issues, and that issues kind of reminded them in a recovery time. So there is a sign, the body knows and the person knows, okay, it was connected. And also our personal story, Hana, is that we had 2 amalgam fillings, both of us, you and me, on the first molars for about 10 years, since the age of 10, and we were always tested on a thyroid gland. We had some limitations there. We did not take any medication, but the pediatrician was always testing our thyroid gland. So that's the first thing. And so what happened to her?
Yeah, just to finish your sentence, Eva, you said we were never having any medication, but imagine we had another 10 years, the amalgam fillings, we would have had medications, right? Like this young lady, she's in her early 30s and she is taking medication because I'm connecting with Mercury, and the gadget, the frequency gadget, is supporting it. And her symptoms are supporting it as well, because now she's on a half of a dosage. And I believe, after we remove everything and after the body is going to be recalibrated, she's going to no longer need the medication at all. But anyway, yeah, so that's what happens if I always just say it is like drop by drop by drop. It doesn't show, any disease doesn't show like overnight, unless it is an acute thing that you're running and you twist your ankle or something. That's acute. But if it is a chronic illness, the seed was planted for it for years before it actually appears in a body, right? In a physical body.
Same time, I would like to say that it's very important we do start talking about it, at least the biological dentist, about these stories, because we do inspire others. And I have to say, everything starts with mindset and awareness. So if you would be aware of that something like this is possible for you by removing the amalgam fillings, that's the first step for your healing. Because I have to say, I have 2 clients this week, new clients, so initial assessments. And we have to start there with the mindset. We have to spend a few minutes talking about what's possible, what the body is capable to do, because they are in the old paradigm of thinking, and they're in the system because they say, okay, if I stop taking this medication, the insurance will not pay later on. So I have to be very careful with that. And I'm not saying to stop taking the medication, but just to be aware of on other stories what's possible. So even the small amalgam filling, which is what I'm talking about, my client I had this week, she had a small amalgam filling and she's taking Euthyrox for her thyroid gland. And I believe that there is possibility that she will not need the medication later on.
But that's true, she needs to see it, right? Reminding me this psychiatrist in the States, the doctor Kelly Brogan, whose story is just the same, right? She is a medical doctor. She is a well-known psychiatrist, and she used to follow the system. She used to be the very, advocate of antidepressants until she developed autoimmune thyroid issue herself. And then she started to dig deeper because she knew there's so many side effects, and she doesn't want to have a medication for the rest of her life from like 30, till the end of the life. And so she started to dig deeper. She started to, study. And now she is leading the movement of self-awareness and self-empowerment and, leading your own kind of life in terms of finding out the information and not believing everything. I'm not just saying do not believe nothing, but you need to always ask, you need to always question, and you need to always find out what's going on. It's like buying a car, right, Eva? When you buy a car, you always kind of find out, is this like how strong the car is? And is this a 4-wheel drive, or is this... And it's the same thing about everything else.
Yeah, and with her story, this Kelly Brogan story, I find it very fascinating because I think that the life brings us things to unwrap. And in her case, she was helping women in pregnancy or after pregnancy with anxieties, and she was prescribing them antidepressants and anti-anxiety pills.
And also, Eva, even in pregnancy, she was specialized.
Yes, she was specializing in that. She was very good researcher. She is still a good researcher, but she's researching other possibilities. She's actually an amazing researcher, and she's showing people what the body is capable of healing other parts of our body, which is the mind and soul.
Yeah, so back to the story. I didn't actually say the very important aspect of this story, because when this lady, my client, went to see the practitioner for the frequency device, and she was telling her that, she's got mercury, high levels of mercury in her body, she then stopped nursing her child. She stopped giving the child, nursing her daughter. And what happened when she stopped nursing her daughter? The daughter stopped having eczema problems, which was shocker for her. She said, I was shocked. As soon as she stopped lactating, the daughter was okay, which, it again gave her another kind of signal and a proof, okay, there must be something really not well in my body, because she realized that through the milk, through the mother milk, all those vitamins, minerals, but also toxins go into her child. So that was very interesting.
And that's why we like to empower all people, because this is exactly where this starts. This starts when you are pregnant. And where it starts before you're pregnant. So we have to go before you're pregnant and see what we consume, what toxicity we have around, what we are using for cleaning our kitchen, what cosmetics we use, the toxicity of those chemicals, and plus what we have in our body. And we have lots of clients who are on their journey to fertility. And this is one of the puzzle they have to undergo, which is the safe mercury filling removal. And I will just only a little bit touch on one story from this week, because also if you don't remove it with a safe protocol, that's not a good idea. I had a client, actually, it was yesterday, who came to see us. She lives in Austria, but she's from the Czech Republic, born here. And she was following us for some time, and she has been having some issues, but the major issue she had almost 10-15 years ago, when the mercury fillings were removed. She was studying music, and she had to really, for her conditions, she had to stay in bed for a year. So that's how much she was affected by removing the amalgam fillings. In a goodwill from other dentists, however, she had really strong reaction to the chemicals and toxicity of the mercury, because it's highly poisonous. So she realized slowly that she was slowly poisoned. Yeah.
Especially the vapors are very poisonous.
Yeah. So, we are happy to share, and we will see what we share next. Yeah, so this episode was about mercury, amalgam fillings, and we are looking forward to hear you in the next episode.
Take care.
Thank you for joining us on Healing Through Dentistry podcast. We hope today's conversation has inspired you to see your smile as the gateway to whole body well-being.
To stay connected, visit us on our website or follow us on social media.
If you enjoyed this episode, please subscribe, leave a review, and share it with someone who could benefit.
Until next time, remember, healing starts with a smile.
Take care,
and we will see you in the next episode.